How many of you have had a CT scan and wondered about the preparation needed in order to get your test done? My name is Earlene. I am a CT technologist. I've been working in the field for 13 years. Today I'm going to demystify the steps needed in order to get the proper imaging. Starting off, it's incredibly important for you to remove all metal for the area being scanned. So starting with clothing, any zippers, belts, buttons, anything in your pockets like change, keys, and any metal jewelry that you have, including earrings or hair clips. For example, if you are having an abdomen and pelvis CT done, it's going to include just above your abdomen, just above the diaphragm, to right below your pelvis. So this for ladies would be bras, belts for boys, zippers. Anything that is a jogging pant, a tight, and a t-shirt is the most friendly to be having on. If you were to have a CT scan and it included metal, you would get a streak artifact. In the image shown, the red arrow is pointing to an earring. This is a head CT. If you could picture, this would be the back of your head, this would be your forehead. This is the earring on the side. The earring, as you see with the green arrow, is causing a streak effect, which is obscuring the actual image itself. This can lead to reduced diagnostic quality of the image, meaning that when the radiologist, who is the doctor who is reporting your scan, looks at this image, he might miss something very important. This can be fixed obviously by removing the earring or positioning the head otherwise in order to make sure that it's out of the field of view. This next image is a picture of a trauma patient, and as you can see with the red arrows to the side, this very bright lucency here is blood. So for this trauma patient, they had an impact that caused blood to seep in between the brain and the most protective outer layer. If this patient had an earring on and had had that metal streak artifact, it is very possible that the doctor may miss this incredibly important find. Something like this could get very lethal quickly, and so again, removing any metal artifacts can greatly help in getting the best image and best report possible. The second part for the preparation of a CT scan is either oral or IV contrast. The oral contrast given by mouth, which in our hospital is just water, can help to enhance the bowel and definitely show the lining of the bowel. If patients have bowel obstructions, this is incredibly important to visualize that properly. Additionally, IV contrast, which goes into your veins, highlights your vessels. In this image here, this is an image of an abdomen. So on the bottom, if you picture the patient lying on their back, this would be the back, this would be their tummy up at the top. This right here is the spine. The two enhanced, because of the IV contrast images here, these circles are your kidneys. And this big round circle here that is quite bright is your aorta. This is incredibly enlarged, and a normal patient would have a much smaller aorta. This is indicating that this patient has an abdominal aortic aneurysm. Without the IV contrast, this wouldn't be visualized as clearly, and there wouldn't be accurate measurements which the doctors need for pre-op surgery. The last important factor of getting prepped for your CT scan is that the patient hold incredibly still. Still with their body, including breathing. There will be breathing instructions for most scans, including the chest and the abdomen. If there is movement during your CT scan, it will cause a blurring effect in your image, and it will again degrade the quality of your image. As you can see in this example here, this is a CT scan of the head again. It looks as if the outer border, this white being the skull along the outside, that it almost looks like there are two skulls. There's a double image there, and that's by this patient moving their head during the exam. I hope that you all enjoyed my presentation, and I hope that by hearing these explanations of how to prep for your CT, that you would feel more comfortable and more confident to go and get your CT done. This would also help you to make sure that you're getting the best imaging possible, and this will help your doctor to get the best results. Thank you very much.